morning and welcome to the UCLAMDChat webinar. My name is Dr. Benjamin Bert. I'm an associate physician diplomat with the Doheny and Stein Eye Institutes in the Department of Ophthalmology here at UCLA. Today, in time for Halloween, I'm going to be talking about the ghoulish risk of costume contact lenses. So those of you who are watching us live, you can ask questions via Facebook or on Twitter using the hashtag UCLAMDChat. I have no relationships with commercial interests, and today we're going to be defining what costume contact lenses are, ophthalmic diseases related to all contact lenses, and also how to protect yourself from developing any of these complications. So Halloween is coming up. Halloween has become a very big business here in the United States. This year it's approximated that about $8.4 billion is going to be spent on Halloween costumes and decorations. Going to my local Halloween superstore, I found these two products for doing makeup, and what I wanted to draw your attention to is the difference between the two zombies that they have illustrated on the packaging. The one on the left has normalized, and the one on the right here you can see is wearing the costume contact lenses, and I think you would agree with me that it actually makes the appearance much more striking, which is what makes this appealing to people when they're trying to really make their costumes pop or really get a response from people. They're also popular now because of what we're seeing in popular culture. So from American Horror Story, The Walking Dead, all of the zombies that are there, music videos, kind of starting with what a lot of us remember as Michael Jackson in the Thriller video. Also in movies, including a lot of the superhero movies, the X-Men series. Also in social media, being seen on YouTube and being used by makeup artists. And also what we see in animation, including anime cartoons. So costume contact lenses also go by a number of different names, including fashion, Halloween, colored, theater, decorative, or the anime circle lens. But no matter what the name is, all contact lenses are considered a medical device. And this wasn't really fully established until a law was passed back in 2005, giving the FDA the ability to regulate all contact lenses. Previously, there was a small loophole that existed for plano contact lenses to not be considered medical devices. However, with multiple case series like this one from the Journal of Eye and Contact Lens, gave many reports of people receiving contact lenses without a prescription and wearing them and having devastating complications, even if they didn't have a prescription refractive power in them. So after these cases were presented, the FDA and the government came together to close that plano loophole and establish that all contact lenses are medical devices. It currently is illegal for retailers to sell contact lenses to anyone without a prescription, and penalties for that start at $11,000 per incident and go up rapidly from there. So when we speak about soft contact lenses, what are we talking about? So on the left-hand side of the screen here, you can see the contact lens has actually been dyed with one of our medical dyes called fluorescein, which is why it has that yellow color. I've outlined here the edge of the cornea, which is the clear windshield looking into the eye, and you can see that the contact lens actually extends beyond the diameter of the cornea. The corneal diameter is about 12 millimeters, while the diameter of most lenses is around the 14 millimeter mark. The reason that that's important is it actually covers the cells at what's called the limbus, which is where this inner dotted line is showing us. And those limbal stem cells are actually responsible for maintaining the integrity of the surface of the cornea, something that I'll be talking about a little bit later. And just to show again that we do use soft contact lenses at time of surgery as well. In certain surgical procedures, we place bandage contact lenses at the end of the case in order to help control pain and also promote healing after certain types of corneal surgery. So then why would contact lenses that are colored or costume even exist in the first place? Well, there are actually medical indications for using colored contact lenses. These are two examples of what's called an iris coloboma, which is a birth defect essentially where the bottom portion of the iris does not close completely. So you can see that the pupil has more of a keyhole type of appearance rather than a circular type of appearance and can be noticeable. This can also give some light sensitivity to the patients, and also cosmetically it may make them feel a little bit insecure. And so colored contact lenses can be used to match the patient's eye as best as possible and fill in that small little defect at the bottom, giving a much more normal appearance of the pupil and the iris. So this is an example of one of the colored contact lenses actually on a patient's eye. And not to confuse you, but there are two contact lenses that are seen here. You can see this first circle here is actually a hard, rigid, gas-permeable contact lens, and that's resting over the surface of a soft contact lens. And you can see that the colored contact lenses is not just one solid shade of color, but it's actually kind of pigmented dots, what you would see almost if you get too close to the television screen, in order to give the blend of the color. The reason that this patient is wearing the colored contact lens is you can see underneath this area of whitening in the otherwise brown iris, which is showing some atrophy, and he was getting symptomatic from light passing through that area where there were small little holes, and this way some of the pigment from the colored contact lens actually blocks that light. So how do you go about obtaining a costume contact lens? Well, I think the first important message is that there isn't a one-size-fits-all lens. Really, the lens needs to be fit to each individual, and each lens can act differently. Even if it fits on the eye initially, it may change once the lens dries out a little bit or once it's been worn for a few hours. And you can see here on the diagram, we're speaking mostly about the cornea here in the front of the eye, and this curvature of the cornea can be quite different from person to person. So with the contact lens, you want it to fit appropriately on that surface. You don't want it to be too tight that it's not going to move, and you don't want it to be so loose that it's going to just slide around the surface of the eye and pop out. So what are really the dangers of the costume contact lenses, and why is that something that I'm bringing up today? Well, despite the 2005 law change and the FDA regulating them, the contact lenses are still found at costume shops, gas stations, over the internet, and at corner stores and flea markets. So it's very important that we all as consumers know about the dangers so that we can protect ourselves and our friends. So one of the things that the studies have shown since the law was changed is that the patients who end up getting their contact lenses from an unregulated source actually suffer from both the lack of education, and also if something goes wrong, they don't have someone that they've established a relationship with in order to seek care. So in order to try to promote this more fully, there are a lot of human interest stories that come out. This one was from ABC News just this past September, talking about a young woman who had purchased the lens at a corner store. We have one from last year, 2015, of a teenager who bought the zombie lenses at a flea market. And we have this story from BuzzFeed where there was a 23-year-old who actually lost the sight in one of his eyes after buying contact lenses from a gas station. So I like to think that the stores and the locations that are selling these aren't doing it maliciously. I think that they themselves may not know the dangers that these plano contact lenses carry with them. Now, the costume contact lenses, because they do have the pigment deposited in them, are different than the normal clear contact lenses that most people use on a daily basis. And when one study was done in the Journal of Eye and Contact Lens using scanning electron microscopy and X-ray in order to evaluate the lenses, they actually found that the pigment was deposited at different levels and sometimes was actually deposited superficially, meaning that you could actually have a little rough spot on the inside of the lens that can scratch the eye just by having the lens inside of the eye. Also, they found that toxic chemicals like chlorine and iron were found to be leaching out of the lens, which also can be toxic to the eye. And because of the addition of the color, there's actually less permeability of oxygen for these lenses, and also the lenses tend to be a little bit more rigid, both of which put the eye at increased risk. Another aspect of it is how much of the lens remains clear. So as the color comes in further and further, and you think about those completely whited out contact lenses, or you think about the cat eye shaped contact lenses, that actually is reducing the amount of light that's able to get into the eye itself. And that can reduce both your contrast, the quality of the vision that you have, and also cause increased higher order aberrations. So if you're going out at nighttime already when vision is a little bit reduced, and you're wearing these contacts on top of that, it's important to make sure that you're extra careful when navigating your surroundings so you don't trip, fall, and hurt yourself that way. And this again was picked up by Fox News and discussed based on a picture of Heidi Klum there. Now I want to take a moment to discuss the circle lens. So this is an oversized contact lens, so it's even larger than that 14 millimeter diameter that I spoke about earlier. And there are no circle lenses that are FDA approved. Now these have become very popular mostly through social media and through fashion bloggers that consider it as kind of a cosmetic oomph to the makeup that they're putting on. And what is being shown is that a lot of American teenagers are getting these over the internet from international suppliers. So a lot of these, again, are people who have never worn contact lenses before. They're not getting the education about how to use the lenses and how to take care of them, which puts them at increased risk. So moving on to some of the ophthalmic diseases that can be related to contact lenses. And now I'm speaking generally about all contact lenses, including those that are worn daily to help correct vision. And mostly these can be categorized into 4 categories: inflammation, structural damage, infection, and resulting scarring. The first and kind of most superficial would be allergic conjunctivitis. So having a foreign body in your eye, which is essentially what a contact lens is, means that your body, your eyelids are constantly rubbing over the surface of the lens. So you may be allergic to the material that the lens is made out of, or you may have allergens that get deposited from the air onto the lens, which then causes increased contact, leading your body to develop a more significant allergic reaction. On this side closest to me, you may be able to see where this arrow is. This is actually right at the edge, again, that limbus that I was describing before, and this is where the lens rests. And so if this becomes elevated, you can imagine that the lens is going to stick there much more. It's not going to move around as much. And so while the initial fit may have been appropriate, the lens now may be too tight, which can lead to problems. Some of those problems are superficial trauma. So simply trying to remove the lens, if it's stuck so hard on the eye, you can scratch the eye, or you can cause essentially what's a bruise on the eye, or what we call a subconjunctival hemorrhage. You can also scratch the cornea as well doing this. You can have little areas of superficial inflammation, which are these little dots that are kind of glowing there in the blue light, or you can have exacerbation of dry eye, which is what we're seeing here with more of these geographic areas of dryness. Also, if you do have the lens fitting too tight, it becomes like a suction cup. So if you've put a suction cup on your skin and then removed it, you see that that area where the suction cup was before becomes bright red. And that's because that tissue has been starved for oxygen. So blood vessels dilate to try to return oxygen to those tissues and prevent any damage that's happened there. When we have that same process happen on the eye, the tissues that get damaged actually become white. So your clear cornea now has little white spots from that damage. If you have chronic hypoxia, meaning that on a regular basis the tissue is being starved for oxygen, the body is going to send out signals saying, I'm not getting enough oxygen, I need you to supply me with more blood, you need to fix this so that we don't have any problems. And that's done by producing VEGF, and then you get blood vessels actually growing into the cornea. And of course we want to keep the cornea clear so that it's able to pass the light through the eye to the retina so that we're able to see. So So blood vessels themselves or fats that leak out of those new blood vessels can cause permanent damage to the cornea and lead to a reduction of vision. Now, when I was speaking about the limbal stem cells before, again, those are the cells that exist on the edge of the cornea and are responsible for producing the outermost layer of the cornea called the epithelium. We are born with a certain number of those, and those are the number that we have for our entire lives. So if they become damaged, we don't regenerate them. And what can happen is if you start to lose too many of them, the surface can become irregular. It's not able to keep up with the amount of epithelium that's being sloughed off or being lost on a daily basis. And so we get these irregular patterns, and you can see like a little eddy or a little whirl that you would see in a river on that side. And again, we can see this whitening happening here behind me, and this is crossing through the visual axis. So this is going to be visually significant. Now, the things that are the most devastating and what we get the most concerned about are corneal ulcers, and they can be divided into bacterial, fungal, and parasitic. So this is an example of a bacterial ulcer. This is a fairly slow-growing bacteria called P. acnes, and you can see this is on presentation, and after 2 months of antibiotic treatment, this was the final result for this patient. So she was able to heal the eye, but you can see this significant stromal whitening from the scar that resulted, and so she did have resulting reduction of vision. Now, a more aggressive bacteria that we see is one called Pseudomonas. And Pseudomonas, you can see, has caused the entire cornea to become white and actually looks pretty soupy. And you may see down here some what almost looks like mucus, but that's actually dissolved corneal tissue that is just melting away from the cornea. And because of how severe this was, and because this patient was going to risk actually having the eye perforate, we had to do an emergent corneal transplant. And so this is donor cornea from a cadaver that was transplanted to remove all of the infected tissue and cause stability of the eye. Now, the patient is still at risk of having the infection continue, and because of that, they're still going to be treated with antibiotic drops. You can also have fungal infections, which are more slow growing but tend to create a lot of inflammation. And you can see this kind of white mass that we see, which is actually behind the cornea. And that's all inflammation. That's actually pus that's inside of the eyeball, or something that we call a hypopyon. Acanthamoeba is also a devastating infection. This is a parasitic infection that usually comes from fresh water, hot tubs, or pools, and patients wearing their contact lenses in those. It has two forms that it lives in the cornea: a mobile trophozoite stage and a double-walled cyst. And it's these double-walled cysts that make it very hard to treat and usually takes months in order to try to get the infection under control. Even a small bacterial infection, though, can have effects on the vision. And this was a very small, less than a ½ millimeter corneal ulcer that just happened to be right in the center of the cornea and caused a one-line reduction of vision after it healed. So now that you're sufficiently scared, how can we protect ourselves from having this happen? Well, glasses are always the safest option. Glasses provide a physical barrier between your eyes and the outside world. If you're someone that likes to wake up with perfect vision and you're guilty of sleeping in your contact lenses, then thinking about doing a laser refractive procedure is something to look into to see if you're a candidate. And if you want to stay in your contact lenses, practice excellent contact lens hygiene. So these 4 national societies came together to kind of give some guidelines about how to take care of your contact lenses, and I'm going to be going through those now. The first is, before you even touch the lens, you want to make sure that you wash your hands with soap and water. Then you want to make sure that you dry your hands with a lint-free towel so that you're not going to deposit any fibers onto the lens itself, which then can get under the lens and scratch your eye. It's also important to know your contact lenses, and the pictures that I've put here on the left-hand side is just a small fraction of the lenses that are available on the market, and each one has a slightly different regimen and slightly different effects that you need to be aware of. So if you don't know about your lenses, then you need to ask your eye care provider to explain to you exactly the facts about them. How often should you be disposing of them? Is it a daily lens? Is it a 2-week lens? Is it a monthly lens? You also want to make sure that you inspect every new lens to see if there's any imperfections, any cuts, any scratches, any manufacturing defects. And you want to follow the manufacturer's instructions and also not share your contact lenses with anyone else. You want to minimize the contact with water. So you want to remove your lenses before you swim or go into a hot tub. You do not ever want to store your lenses in any type of water, whether it's tap, sterile, or distilled water. You also do not want to use saliva as a re-wetting agent. So if you put the lens in your mouth and then put it into your eye, you're taking all of the bacteria that live in your mouth and transmitting it to the eye. And there's many more bacteria in the mouth than in the eye naturally. You also want to make sure that you're cleaning your lenses, and that means also disinfecting them. So look at what your solution does, and even if it's a no-rub solution, you do want to rub the lenses. The studies have all shown that the action of rubbing is able to get off particulate matter and also reduce the amount of bacteria that's there. You can also use some of the hydrogen peroxide neutralization systems, which help to remove proteins and reduce the risk of acanthamoeba and bacterial infections. Some fungal infections can actually still live through that system. And don't forget about your case. The case is where you're storing your contacts for maybe 8 or more hours a day. So if your case is contaminated, that contamination is going to be transmitted to your contact lenses. So after you take your contacts out in the morning, you want to rinse out the contact case with your saline solution and then leave it open to dry during the day. You want to make sure that you're replacing it at least every 3 months. And the reason that we have this picture of this particular case, you can see some of the buildup and some of the dirt that's actually formed on the edge of the case. And this was a case that we ended up having to culture because of someone having a corneal ulcer. And we were looking for the pathogen and see if it came from the contact lens case. When you're using the solution, you also don't want to contaminate your solution. So you want to make sure that you're not touching the tip of the solution bottle to anything else. So spraying in the solution from a little bit of a distance, maybe not this far, but maybe an inch or two is sufficient. You also don't want to change the vessel of your solution. So if you're going on a trip and you need a smaller bottle of solution, buy a smaller bottle of solution. If you pour contact lens solution from the regular bottle into another bottle, you run the risk of contaminating it during that process. Now, what about all of the contact lens wearers that are out there? If contact lenses are so risky, why don't we see more infections? Well, a survey was sent out to a number of contact lens wearers out of the 41 million that exist in the country. And actually, the survey did find that greater than 99% of contact lens wearers had one or more risks. And the primary risk was overwearing the lens. So either wearing them too long or sleeping in the lenses. Now, if you try to be perfect, you want to make sure that you keep up with your annual exams. Over time, the shape of the eye can change. You can develop allergic conjunctivitis, and you want to make sure that this is caught before it causes any problems. Also, there are times when things happen that are out of your control. And in the past, we have these reports demonstrating that sometimes the contact lens solutions themselves can be contaminated. And so at the first sight of anything happening, you want to go to your eye care provider and have them take a look at you and see. Because by quickly responding to this, we were able to stop these outbreaks. So again, if something is wrong with the eyes, if it's red, if you're having pain, if you have foreign body sensation, your vision's changed, you're having discharge, the first thing to do is take out your contact lens, and you really do want to call and see your ophthalmologist. So in summary, it's okay to wear an FDA-approved costume contact lens, although you may want to wear it for fewer hours than you would a normal standard contact lens because of the reduced permeability to oxygen and some of the other risks. Practice good hygiene with your contact lenses, since improper care or use can really cause you to be putting your vision at risk. So again, the increased risk for infections, extended wear, sharing, and having them exposed to water. And remember, on Halloween, you want to look like this, and afterwards, you don't want to end up like this. So thank you, and I hope everyone has a safe and happy Halloween. And these are my references, and we're going to take some questions. Thank you. So the questions that we have, the first one, if I have contact lenses that are 2-week disposables, does that mean that I have 14 times that I'm able to wear them? So 2-week contact lenses are 2 weeks, that's it. So once you crack the package open, you have 14 days to use those lenses. A lot of people are under the misconception that 14 days equals 14 uses, but the bacterial contamination is still happening and the bacterial growth despite how many times you've used it, just based on the time that the contacts have been open. And someone is being honest and saying, I've been sleeping in my contact lenses without any problems. Should I stop doing that? Yes. So again, extended wear of the lens is one of the greatest risk factors for developing corneal infections. And even if you haven't had a problem yet, it's kind of like gambling with the health of your eye. It only takes one episode that can have devastating complications. And the risk of having an infection is about 10 to 15 times higher for someone who does sleep in their contact lenses. And our third question here, can you become allergic to all contact lenses? So this is something that I have seen happen, and it's called contact lens intolerance. And typically, if someone is having a reaction to one of the makeups of a contact lens, say it's a silicone hydrogel, we will try to put them into a different type of contact lens made out of a different material and see if they're able to tolerate that. But some people are actually just allergic to that contact of the eyelid rubbing against the surface of the lens. And some people who have been contact lens wearers for a long time are no longer able to continue to wear their lenses. So I think that's all the questions that we have for today. So thank you for joining us this morning. And again, I hope you have a very happy and safe Halloween. Thank you.